We're back with Steve Edmonds of Alliance Insurance Services and Catherine CVA with AARP. Catherine, you were making a point about what people should do with their HR department.
Yes, so if you are still working and you're thinking you're going to defer Part B, make sure that you talk with your HR department to make sure that your insurance is credible coverage that Medicare will accept, because there are some times that the benefit is not rich enough or meets their criteria, and then you could get stuck with the premium later with the penalty.
Good to know. All right, Steve, this person says, what is Medicare Part C and why do I get so many calls about signing up for it?
Part C is very popular. Part C is we call it Medicare Advantage. And what Medicare Advantage does, it takes Part A, Part B, and Part D, your drug coverage. It combines it all together into one unit plan where you just have this one coverage. And also Part C, which is Medicare Advantage, it also includes a lot of perks like vision, dental, hearing. It also includes stuff like over-the-counter drug coverage that you get an allowance on. And it pays for gym memberships, and that's just to name a few. There's a lot more perks on it, but they're very good plans nowadays.
All right, and do you suggest that people do that? I mean, what's the percentage of people that you have that do that?
Typically, when we're looking at plans, if a person has a lot of severe health problems, severe diabetes, heart disease, cancer, a lot of times they're going to be better off with regular Medicare and a Medicare supplement, because at the end of the day, that's typically going to pay about 100% of all their hospitalization and doctor bills. If they're in good health, Medicare Advantage might be a good fit. And if the premiums are really, really high for a Medicare supplement, Medicare Advantage can still be a really good fit, because you're going to have an out-of-pocket maximum on Medicare Advantage anyway. It's usually $3,500, $3,600, $3,700. So it's a good plan.
Okay.
Really good plans nowadays. Yeah.
Catherine, this person says, I'm employed and I have health coverage through my employer. I turned 65 in November. Do I still need to sign up for Medicare, or can I wait until I retire?
You must sign up at 65. There's no exception to that unless you want to pay a penalty when you do sign up later. And there are penalties associated with all the parts, but the Part B penalty is forever.
All right, Steve, this person says, if you take out money from your 401k or your IRA, will that affect you with anything with your Medicare?
Not necessarily, but it could. The federal government and Medicare, they look at your total household income, and they'll look at tax records or whatever. And I think for a married couple, we were talking about this off air a minute ago, it's $194,000. So if you're a married couple making in excess of $194,000, you're gonna pay higher Part B premiums than a regular person might pay. So yes, that could affect you, but if you're well below 194,000, it may not affect you. So you're going to have to check with your accountant probably on that.
All right, this person's asking.
And Steve, I looked it up. It's 97,000 for an individual.
Okay. Yeah. So
97.
Yeah. So yeah.
All right. This person's asking, how do I get silver sneakers once I sign up for Medicare?
Many of the plans automatically include silver sneakers. Almost all Medicare Advantage plans, I wouldn't say 100% of them, but a lot of them automatically cover silver sneakers. And also a lot of your Medicare supplement plans nowadays, they also cover silver sneakers. So you just have to check with the plan, check with the agent, and see if that's available on the plan that you're looking at.
Hey, Catherine, this person's asking, what's the difference between Medicare and Medicaid?
So Medicaid is the program that supports additional health care needs of people who are low income or disabled, and certain types of disabilities. So people can still have Medicare when they're over 65. And if they were low income, they might be eligible for Medicaid, which would help undercut or cover the other things that they might need in addition. So Medicaid is definitely income driven completely.
All right, when people have questions, again, we wanted to let people know you can talk to an independent insurance agent. You can also talk to AARP, has some helps as well.
They do, and the North Carolina SHIP program has great help, particularly if people are struggling with their finances. They are able to tell you what you might be eligible for.
Okay, we could probably do a whole hour on Medicare and health insurance. I appreciate both of your time and your expertise. For those of you, if you missed anything, it may answer your question to go back and listen to it again. It's going to be in the Two Wants to Know section.